We're really privileged to have today two UT Southwestern professors. The first one is Dr. Ahmad Raza. Dr. Raza is a professor in the Department of Psychiatry at UT Southwestern Medical Center. He specializes in refractory depression, obsessive compulsive disorder, neurostimulation, and psychopharmacology. Dr. Raza earned his medical degree at the King Edward Medical University in Lahore, Pakistan, and he earned his doctorate in pharmacology at the Southern Illinois University School of Medicine, where he also completed a fellowship in pharmacology. He's certified by the American Board of Psychiatry and Neurology, and he joined UT Southwestern in 2005, serving as the medical director of the inpatient unit at Zale Lipsche Pavilion for more than a decade. He's been involved in teaching and training medical students, residents, and psychiatrists for 25 years. And we're also pleased to have Dr. Jenny Hughes with us today. Dr. Hughes is an assistant professor in the psychiatry department at UT Southwestern. She serves as the head of the Risk and Resilience Network in the UT Southwestern Center for Depression Research and the clinical care. Her research explores the efficacy and effectiveness of psychosocial treatments for building resilience, the prevention and treatment of youth depression, and addressing suicide in youth. She's a graduate of the University of Texas Health Sciences, and we're very pleased to have both of these doctors here today. So what I would like to do is turn it over to the doctors who will give us a background on mental health, anxiety, resilience, and grit in this very unusual time. Before I do that, I would like to ask that if you are on the call, to please mute your phone so that we can hear the speakers. And with that, I will turn it over to Dr. Raza and Dr. Hughes. Thank you all very much.
Thank you, Jeff. Good afternoon, ladies and gentlemen. Thank you to Jeff and Jenny King for putting this discussion together. So what I would like to do is make a brief opening statement, just sort of encapsulating what we're going through and summarizing some of the issues, hopefully allowing those issues then to lead into more in-depth discussion and questions. We would like for it to be as interactive as possible. So I think, yeah, as we look at this enormous and rather unprecedented challenge, as it is unfolding, it's almost like witnessing history and living through history. How we deal with this challenge, either individually or collectively, I think it's safe to say that it is going to leave some indelible, some strong impressions and marks on our psyche, on our life. I think never before can we, at least in recent history, come across an event where so much of the mankind and so many people have been so directly affected in such a short period of time. There has been obviously very little time to adjust, very little time to even process or think through what is happening, while our lives have been very, very dramatically altered. So these are really truly times without any precedent, and they are going to require extraordinary steps, extraordinary courage, I think some ingenuity, and even, tremendous resolve for us to be able to not only get through the situation as it stands, but also minimize the long-term impact on our society. And eventually, the hope is that something positive can come out of this tribulation. So Glenn Richardson, who's done quite a bit of work in this arena, and I'm sure Dr. Hughes is very familiar with his work, has really theorized a model between stress, emotions, and performance. So his proposal is that any stressful event or challenge once it occurs, is mediated and to some degree even amplified by perception, by how we appraise the situation, what kind of attribution we provide to the situation, and whether we engage in more adaptive coping or maladaptive coping, which can lead to a response or our behaviors, which will eventually determine the outcome. So I hope as the discussion progresses, we can focus on each of these different elements, which will eventually determine our response in the long term. So I think one of the things to remember in this context is that pandemics like this one really tap into the core or the essence of how our fear or anxiety mechanisms work. They typically start, certainly, particularly this one, evolve very novel or unusual situation, things that we are not used to, encompass a lot of uncertainty as opposed to predictability. And this is an imminent danger. It is not one of the issues that one can put off. Unlike some other issues where the effects may be long-term, here we're looking at the here and now. And on top of that, we're looking at potentially serious outcomes, including, in many instances, severe health issues or even death. Viruses and pandemics are uniquely anxiety-provoking, partly because they tend to be invisible. We don't know where this thing is lurking. We have very little idea who has it, how we may be going about routine things in our lives and end up getting it. So the uncertainty, the invisibility of it is, goes without saying, is a paramount factor. So the problem is that when anxiety or fear, in many cases, it to some degree is adaptive, in the sense it makes us do things, it makes us take the steps that are necessary. But it's almost sort of, if you look at the performance in anxiety, is almost like a bell-shaped curve, that up to a certain point, it helps. But after a certain point, if the anxiety and fear goes beyond adaptive range, it begins to then impact how we think, how we behave, how we function. So there are two particular biases that fear and anxiety can introduce. And one of those biases is related to the attention that we pay to information. So we are already anxious, we are already fearful, we are much more likely to pay attention to information that substantiates that. And the second thing is that our interpretation of events and information becomes colored by our anxiety, particularly when the information is ambiguous, as it is. It's an evolving situation, things keep changing. So this can set up a feedback loop. So the anxiety leads to a certain way of thinking and behavior, and then that feeds back into anxiety and compounds the issue. So this, this pandemic and its lingering effect may last a significant period of time. And the process will unfold over several stages. So the first stage is for us to deal and cope with the current situation in the here and now. Then we're going to move towards a stage of recovery, hopefully followed by a stage of normalcy, and then a stage where we will begin to look at long-term impact on individuals, on our culture, on our society, our economy, and so forth. So there's something known as epigenetic principle in human development. And I think you can apply that principle here. And the principle basically says that if things happen in stages or phases, it is important that we accomplish the initial stages with some competence. Otherwise, it may impact how we deal with the future stages. So it is very critical that we, as we go through and negotiate this process, that we pay attention to the way things are now and deal with them now and be willing to anticipate how things are going to progress in the future. So by the same token, if we have made mistakes or we've had failures in the past, that really should not deter us from pursuing the right course in the future. So getting bogged down by what could have been, should have been, those are important things to look at. But I think it's very, very critical to look at the here and now and the future. So the point is that we are in this together, and our actions, I think never in the history that I can recall, at least recent history, where each individual's actions matter to this degree. And it is not only a question of they matter to us, but even more importantly, how they matter to others. So I think we are truly, if we can use that term, which sometimes sounds like a cliche, now we are truly in this together. There really is no cure, as you know, there is no treatment for this. There are some very simple and common sense measures, which sound very unheroic, unglamorous, but the problem is that those have to be done extremely consistently. So we've had previous experiences with similar events that we've learned a lot from in terms of the previous pandemics or the previous adversities that we've faced. So we are not in completely uncharted waters. Yes, this is unique, this is different, but we've learned a lot from previous instances as to what factors can affect our response, who are the vulnerable populations, what the outcomes can be, and what we can do to change those outcomes. So I think as we go through this process, we really have to, in these difficult times, go towards a much higher calling and a much greater resolve than we've ever had to use in the history of our nation. And with that, I think as the resilience and coping become more and more critical for us to deal with this situation, I would hand over the mic to Dr. Hughes. She's going to probably make an opening statement dealing with some aspects of resilience and coping.
Yes, thank you. And thanks to everybody for joining us today. So I think, as Dr. Raza mentioned, we do know some things about how people deal with trauma, right? And deal with high stress and tragedy. So let me get a couple of terms out there first. Resilience is really that ability to bounce back from stress or to rebound from some kind of adversity, oftentimes as strengthened and as a more resourceful person after that event happens. And we do know that you're not born with a finite amount of resilience. It's not like you came into the world with that and that's all you got. Resilience is something that it can be formed and shaped over time. And in fact, stress is needed to form and shape that kind of resilience muscle, as you think of it that way, over time. So most of my work has actually been with children and adolescents, thinking about how we can integrate some components of resilience into the classroom, and hopefully with the idea of preventing future depression or suicide attempts. In particular, I think it was mentioned, I work at the UT Southwestern Center for Depression Research and Clinical Care, and along with Dr. Madhukar Trivedi, the director, and our team, we actually have a study of resilience right now at UT Southwestern, where we are recruiting a group of 10 to 24-year-olds who either have some kind of history of anxiety or a parent with depression, something that would put them at risk for developing depression. And we're studying resilience to life events over time. This study has actually been going on for the last 3 years and will continue for at least 10 years. And so we will have an opportunity now to really look at how people rebound after this pandemic, and particularly in this group that we've already been working with. So please feel free to email me if you're interested in more information about that program after today's presentation. So when we think about resilience, first I want to make the point that resilience really reflects a range of coping strategies. I can't really give you a formula for these are the 5 exact things you need to do to cope with this that will pull you through as more resilient. Part of it is learning the ways that you cope, and then having really kind of a deep bench to pull from. Dr. Marsha Linehan is one of my mentors in something called dialectical behavior therapy, and she often talks about how not any one coping skill works every time, but there's a lot of coping skills, and you can always find at least one that will work. And so I'm sure you guys see all of the lists running around right now on the internet of different resources for how to cope. There are some from really great reputable sites like the American Psychological Association, the American Psychiatric Foundation for Children and Adolescents. For example, the Society for Clinical Child and Adolescent Psychology is a great resource, effectivechildtherapy.com. I think you guys will get some resources from us, but I refer you to those lists, and I'm happy to speak more directly about some ideas related to ways you might cope now as we get into the questions. But I think, again, resilient people have a range of coping, and they learn how to kind of flexibly practice that coping over time. Also, being resilient doesn't mean that you don't experience distress. It is perfectly normal and actually adaptive, as Dr. Raza said, to experience fear right now. And that fear is actually probably motivating you to do some things that are actually really important for your health, right? Things like washing your hands and things like social distancing. We need a little bit of anxiety in people right now to be able to really feel the resolve and the motivation to do those things that are going to help us all as a community at this time. At the same time, resilient folks notice when they're getting distressed. They put a name to that emotion and frequently have ways to check in with themselves so that if that really intensity of distress gets so high that you're just frozen and not sure what to do, or so high that you find yourself feeling kind of urges to do something that's going to make it even worse for you. That's the point where a resilient person knows to kind of notice that point and get some help, right? Ask other people for things to do, or to go to kind of their list of ways they typically cope to maybe bring that emotion down a bit. We do have data from other kind of large unexpected events like this, like the LA riots, post 9/11, after the Oklahoma City bombings, after some of the school shootings that we've had recently. We have data that really helps us understand how people respond to these big kind of unexpected traumatic events. And the good news is over half of people, usually up to about 60% of people, end up having a pretty resilient response, where they kind of make it through. They're able to maintain a stable equilibrium, even if they had a short period of time where they were really distressed or having a little trouble with sleep or a little bit trouble with coping. Most people are able to make it through. The other trajectories that are pretty common after these kinds of events are seeing kind of a gradual, slower recovery. Some people will experience chronic distress or maybe even post-traumatic stress disorder. Some people may do a little okay and then have some delayed distress later. And then there's even been some data that people can show psychological improvement. So people who already had depression or anxiety before an event like this, because of some of the resources and some of the connection they make after a trauma, may even come back kind of stronger than they were before and see improvement in their symptoms. So I think that's hopeful. That brings me to one thing I wanted to really stress today. If you are somebody who already struggles with any kind of mental illness, whether that's depression, anxiety, or something like bipolar illness, now is a really important time to stay connected with the current treatment you have and to be sure you stay consistent with that. Because we typically know that if you're somebody who already struggles, you add an extra layer of stress and potentially your symptoms might be impacted by that. So now is the time to really consistently take any medications that you've been prescribed by your physician, continue to work with your therapist. Luckily, we have really great teletherapy options now. And so be sure you stick with what you know if you're somebody that's already in treatment. If you're somebody that's never been in treatment and you decide it might be helpful for you, there are options out there to even start treatment now. So again, we have some resources, I believe, on a list that can help direct you to that if you need it. So a couple of things about resilience. The American Psychological Association has a really great website called The Road to Resilience, and it includes kind of an overview of the different things to remember if you're trying to really kind of tap into that resilience within yourself and or if you're trying to build that up. One is really focusing on connections. So connecting with people that are important to you. I know we are social distancing, but I think I've heard the term physical distancing. I like that a little bit better because it really, it's not that we need to socially be away from each other right now. Social connectivity remains very important for us to be able to cope through this and to come out more resilient on the other side. And so really finding ways to connect with your teams as leaders and employers, really helping to connect your staff and your employees and thinking of some creative ways to do that. To build resilience, just making sure you take care of general wellness. So taking care of your body, eating, sleeping, exercising. If you can, getting out in nature. I recognize some of you may actually be quarantined or in situations where you're not able to get outside, but thinking about ways to open up a window at least, or even take some time looking at like photos of nature can really kind of bring some of that same kind of relaxing response. And then really making sure that you are thoughtful about the amount of media that you're taking in at this point. Having a select time or two during the day that you do look at news or that you work to kind of understand how things are going both locally and around the world, but not having that on constantly. So that you're able to really have some time of mindfulness and some time of relaxation where you're focused on the things that you're doing and truly able to enjoy those things. We know another pathway to resilience is really trying to find purpose. So finding some activities to do that really map onto your personal values, finding ways to help others, to be a helper, really being proactive. So again, if you notice that your emotions are getting really high or that you're getting distressed past that point of it being helpful, as Dr. Raza talked about, past that peak, really knowing that you have people you can turn to or some coping skills that you can kick in and trying to do those things. Figuring out what your realistic goals are right now and what you can do. So obviously there's certain things maybe for your business or for your family that you can do right now, and there's certain things that just may not be possible. This might be an interesting time to pull up some of those kind of back burner projects that you have, or those things that you would have done, oh, if I only had time. This is the time maybe to pull up some of those things and see if you can get a little creative and maybe try something new in the workplace or at home. At the same time, realizing right now you're probably not your best self. Your resources are a bit depleted. I know I made a joke to a friend the other day. In our culture, we're all going to be try to be the best at social distancing and the best at quarantining. I've seen so many articles about how to come out of this like a phoenix, you know, that's just totally revamped your life and yourself and everything about it. I think you need to be realistic. We are under a time of stress right now, and I think everybody's emotions are running a bit high, particularly fear. And so being gentle with yourself, realizing that good enough is okay right now. But at the same time, if you feel a pull for being creative or trying something new, it might be a nice use of your brain to kind of do something a little bit different. And then kind of keeping an eye on your thoughts. Dr. Raza sort of mentioned this, but really trying to keep things in perspective. We are literally all in this together, not only here in Dallas, but across the United States and actually across the world. And so remembering that, you know, I think these things are impacting all of us, and none of us have done this before, and that's okay. And so being kind of open about that with those in your life and, you know, keeping that perspective is important. I think my kind of 4 boil down points for how to cope with anything came from one of my mentors. And one, if you can, problem solve it. If you can't problem solve it, maybe try to change the way you feel about it. If you can't do that, accept it. Or your last option is always to just kind of stay miserable or make it worse. And so just kind of thinking about how your different responses may fall into those categories and what might be useful for you over time is going to help you, I think, frame up how you're coping with emotions at this time. The last thing I'll say before we turn it over to questions is I also think it's really important for us to acknowledge the collective loss that's happening right now, and that grief is probably a feeling a lot of people are having. David Kessler just published a really great new book called Finding Meaning, The Next Stage of Grief. And he's somebody that worked for a long time with Dr. Kubler-Ross, who was the one who came up with the model of grief that so many people know. But I think grief is really just the death of something. I think we often think of grief more as the death of a person, but grief can also be felt in response to a loss. And right now, we've all kind of had the death of something. We've had the death of a typical workplace. We've had death of being able to go to the store in ways we normally are able to and hang out with the people that we enjoy hanging out with. And then unfortunately, some people have experienced death of people, family and friends that they love and care about. And so I think acknowledging the feeling of grief that may be coming up can be really important too. And again, I think I've provided some resources that can help you guys think more about that. So with those comments, I'll go ahead and turn it over to Jeff to take care of our Q&A portion.
Great. Thank you, Dr. Hughes and Dr. Raza. I want to pick up on something that you all both touched on, was that we're all in this together and we're all going through this at the same time. Obviously, most of us are now working from home. And so what are some ways that, recognizing that we're all in this together, how do we combat loneliness, isolation, some of these other things that we're all starting to feel given the circumstances?
Yeah, I mean, I think, well, one, I think recognizing that everybody's situations are kind of different in this way, and not assuming that you know what anybody's dealing with when it comes to loneliness. I know for me, like, I live by myself, so it's me and my 2 dogs during this situation. Whereas a lot of my friends, it's them and their spouses or partners and multiple children. And it's a lot of together time. And they report not feeling lonely, but actually feeling really kind of distressed to not find any time alone, right? And so I think while we're all in this together, we still all have some unique circumstances within this. And so I think one, just figuring out the ways to connect that make sense for you, your family, and also your work team. One really great thing that we've done on some of my teams is we have a Monday morning, basically it's coffee talk, where for 30 minutes to start the day, everybody's getting on our kind of Microsoft Teams meeting and just sitting there drinking our coffee together. And it's really nice because it kind of mirrors that water cooler chat, that kind of intangible time spent together at work, that you're maybe not meeting objectives or going towards goals, but that you're just kind of talking about how your weekend went or what you did or what you're thinking about. And so creatively trying to create some space for you and your employees to have moments like this where you're connecting in kind of new ways, but still having a chance to have some of the chats that you would normally have when you're at work. So setting some space for that. And then I think getting really creative with your family and social time. Definitely there's ways to do virtual happy hours. There's ways you can watch movies together and kind of comment on that experience. Me and some of my friends even did a cheese tasting virtually. So Scardello's put that on, where you could go pick up a cheese platter and watch a Facebook Live where you learned about the different cheeses and you all watched it together and had that experience. So I think businesses are also getting creative about this. And so figuring out ways that you can connect virtually and really making time and plans to do that, especially as these weeks kind of wear on us. Dr. Raza, anything you would add? Oh, can you unmute? I think you're muted.
So I think the thing I would like to add to it is that we recognize that working remotely, and in fact, we're already beginning to see some challenges, particularly as it gets extended. Right now is still, we're in the early phases. And the challenges that most people are reporting is difficulty setting up the same structure and routine at home when you have a lot of other distractions. You still have your family obligations, your kids could be home who need help at school. So in order for you to maintain a very, very good structure and routine, you really have to go out of your way to make that happen. And literally, assign time for professional activities and making sure that you don't overdo in that regard and are able to maintain some balance with your personal leisure, with your family obligations, and so forth. So the points that Jenny made, obviously, they've been well publicized and talked about in terms of, controlling the flow of information, being sort of connecting by video. is clearly more beneficial than simply, texting and videos. The kind of emotional connection that it can create is a much preferred medium of communication, and there are many, many options available there. I think the most important thing is, how do you maintain a certain sense of normalcy when you don't have those opportunities? And as Dr. Hughes said, that the issue is to accept to some degree what we're dealing with, but within that constraint, to normalize things as much as we can for ourselves and for the people around us. So, all the things that Dr. Hughes mentioned make a lot of sense. The question is, are you willing to implement those? I think the key thing right now, we can talk about resilience and those kinds of things. Resilience and other things develop over time. It's a process. I think the key thing we need to focus on right now is coping. How do we get through this and add to that resilience, or for that matter, things can go the other way too. So when it comes to coping strategies, I think that is where a lot of things have been shown to work, and a lot of things have been shown to be actually detrimental. So I think if we focus on the things like, what Dr. Hughes mentioned, acceptance of the reality, knowing what we control and knowing what we don't control, and having a workaround and innovative ways to deal with that, having a problem-solving approach, reaching out to our social supports and emotional supports, not getting into an avoidance behavior. I think the risk of the current situation is that, since it is already somewhat of a period of isolation, that we could easily go in that direction even further, to where we even isolate further. So I think to deal with this, and then obviously the three things that I would absolutely recommend to everybody to focus on is nutrition, exercise, and diet. All three of them have beneficial effects for your physical health. All three of them have beneficial effects for emotional and mental health. All three of them have immunological benefits in terms of reducing inflammation, in terms of, to some degree, strengthening your immune system. So if you can focus on those three things as primarily the activities, other than the social connectedness and reaching out to others, I would strongly urge that this is the time to not only do those things, but make them a part of your life, hopefully in the long term as well. So there are many, many things we can do. And as Dr. Hughes mentioned, that despite all of this, vast majority of people turn out just fine after such events. If you look at about more than half of the population at some point have been exposed to trauma or difficulties, but less than 10% of them, the numbers are typically around 8-9%, would develop any significant long-term PTSD type problems. So I think to have faith that we can get through this, and I think that for vast majority of us, this could be an opportunity where, as Dr. Hughes mentioned, resilience, one of the outcomes is viewed, one theory is it's an outcome. And one of the outcomes is that you grow stronger with better protective factors, as opposed to coming out weaker, both as an individual and as a community and a country.
Thank you both doctors for that. I see a number of business leaders on this call, and can y'all talk about what we in the business community can do to help employees cope with things, to be aware of what some concerns that employees are having, especially in this socially distant environment? What can businesses be doing to help?
So, Jeff, in that regard, I would like to point you to a very, very good study or a survey published by Gallup. So Gallup has been for the last 8 decades, starting from Great Depression, they have been serving employees. I think it's very critical to understand what the employee's perspective is. I mean, we can certainly come up with strategies from our perspective. And so over the last 8 decades, they've gone through Great Depression, World War II, 9/11, the economic crisis. And there's some very amazing consistency. So what they did was they did a meta-analysis, which is essentially pooling all the data and to see what the commonalities are. What are the employees looking for in this setting? And the employees are really looking for two basic things. One is a path forward, and which has been shown in all of these distressing times, for somebody to show them that there's a path forward. And secondly, how they can contribute to that path forward. So one of the things that has been very consistently identified, there have been 4 factors that employees over the last 8 decades have consistently identified as important or qualities in the leadership. And the first one of those is compassion. The second, the quality is obviously stability. The third is trust. And fourth is hope. So think of those four things. And if you can somehow or the other create that environment, you can convert employees from those who are overly fearful and sort of in a more avoidant situation to those who are more engaged and sort of more engaged in self-actualization. The other key thing that Gallup came up with, this is an excellent study because it doesn't look at only this issue, it looks at all the issues and finds commonalities. The other issue is re-engaging with the employees at the immediate supervisor level. We're not talking about the top leadership, not a CEO, you have a role, COO, you have a role, but the people they respond to the most are their immediate supervisors. So they understand them better, they understand their issues better, and it'll be important to sort of go back for the managers and supervisors to reorient, literally start from a scratch. That is what they recommend, is to reorient them to their responsibility, to their needs, provide emotional support. And the key thing that employees are looking for is, are you looking out for my interest? So for them, the most important thing is the organization interested in their well-being, as opposed to interested in their own issues. So I think that is a very, very important insight into what people are expecting. And Dr. Hughes, if you have some comments on what the leaders can actually do to help with that process.
Yeah, so that's a great meta-analysis. I like that it's looked over several studies over time. A couple of key things. I think one, really creating open communication, setting up a pretty structured communication within your organization. Again, kind of goes with that idea Dr. Raza said of like, how is this going to affect me? I think realizing our employees talk to one another, and that's actually a good thing. And at the same time, while to top leadership, kind of rolling out certain decisions and layers and letting people know kind of bit by bit, or maybe even putting people on furlough bit by bit, makes a lot of sense. Certainly, if employees feel like they have no sense of what that plan is going to look like or how that might unfold, that can be really distressing, right? And so just really having a structured way you're providing communication. It might be that you have some kind of like brief, regular place to do that, or a weekly email or a twice a week email. It may be that you roll it out with immediate supervisors, the kind of directives, but at least that's being consistently done across supervisors so that different teams are hearing information in similar ways. That can be really important. You just want to set up a place where people can ask questions if they need to, and also where they feel like they have an understanding of what's going on. Kind of goes with that ideas of stability, trust, and hope that Dr. Raza mentioned from that study. I think we've talked a lot about, finding ways for employees to connect and making sure your employees are aware of any resources that your companies do have, things like employee assistance programs, making sure they know about EAPs if needed. so that if any employees really do start to struggle at the point where they want to seek out a professional, making sure they easily know how to do that. And then again, that sort of idea of, we're all in this together, and it's okay to not know what's going to happen with your company, and it can be stressful as a leader to not have a sense of what you're going to do, and that might be changing over time. And, kind of naming that discomfort for yourself, and figuring out, places where you can give staff some flexibility, or where you can maybe pair up different staff members to work together. If you have kind of more established staff members who kind of know the task a bit better, putting them with newer employees who may still kind of feel a little even more disconnected with having gone to work at home so quickly. But really trying to have ways that you're checking in with your staff, and also taking a little time for yourself to be away from that leader role, so that you have times that you're not working when you can be practicing some of those different self-care and coping strategies we talked about. You also need rest.
Thank you both. You talked about the importance of staying connected and some things that employers can do to implement to help with mental health challenges during the COVID duration. Are there things that employers can be doing, policies and procedures that leaders should be implementing to protect employees from chronic stress and poor mental health, both during this unusual time of COVID, but also outside of COVID?
I think one of the key things is that people are looking for what I would describe as is not only a competent leadership in terms of the clarity of decisions, the clarity of actions, but they're also looking for compassionate leadership. So being able to empathize with their situation, showing competence, calmness in the context of compassion. I think that approach is the key approach. Obviously, the first thing is the physical safety and well-being of your employees, as well as the emotional well-being. So being able to, obviously, different business leaders here have probably different business models, and they've been able to maybe transition their businesses to different degrees. But to the degree that we can provide that physical safety, obviously making sure that they are part of the process, that they are following the same directions that all of us are following. The important thing, as Dr. Hughes mentioned, is communication. I think a communication which is not only, which means that you have to be very well educated, but communication which is contextualized, in the sense that communication that is relevant to them. Not only clarifying, what the exposure data and other hospital data looks like, but how does it impact them, their job, their business, their future, and so forth. But giving them an opportunity also to be able to communicate back with you, that it should be a safe communication environment, where they should not hesitate to express the issues that they're going through without any fear of repercussions. Things that have really helped is to obviously you have hopefully a supportive work environment, but to make it even more supportive. As Dr. Hughes was mentioning, what people miss is not only the routine of the work, but the social connections that they have there. So to be able to create some kind of virtual meetings, to create not only professional interactions, but also personal interactions is going to be very, very critical. And to recognize when your employees are not doing well, and to destigmatizing getting help. Last week alone, I had 2 of our physicians, faculty physicians, who had never been treated, who were going through some stress, reached out to us. They know that they're probably not going to require this for the long term. But I think the most critical thing to explain to your employees is that if the distress gets to a certain level, that seeking help at this stage is going to be critical. And obviously making accommodations for their personal needs, whether they can work remotely, to be aware of the resources that you can provide to them from the mental health perspective. So there are a lot of things that you can do to get them through this situation.
I don't think I have anything to add. I thought that was a great summary.
Great. Thank you both. Gregory Kuhn from LAN has a question. Gregory, do you want to unmute and ask your question? Okay, we'll come back to Gregory. I've also got a question from Hilda Loria. Hilda, do you want to unmute and ask your question?
Sure. Can you guys hear me?
Yes.
Yeah.
Hi, thanks, Jeff. And thanks, Dr. Hughes and Dr. Raza. So I'm one of the pediatricians at UT, and I had asked a question about, so for those of us who are still working every day, taking care of patients, are there any strategies to address the grief associated with having to practice medicine in kind of a less than ideal environment and manner? And then I'm also struggling with having the emotional energy to sort of shift focus to more meaningful things when I'm not in the hospital or in clinic.
I think in that regard, let's first acknowledge the difficulty that the healthcare, not only healthcare workers, but all people who are in essential services who have to be out there. Obviously, healthcare workers are on the front lines, some of them. But I think also appreciating that there are a lot of people in the grocery stores, in the pharmacies, in the delivery services, who are also taking a certain amount of risk. So I think that sense of collectiveness, I think, is very important. To realize, you know, we are working under obviously very difficult circumstances because of not only the nature of what we're dealing with and the our own concern about catching the infection, affecting our loved ones around us, but also in the circumstances that we are working with the limitation of the resources. So I think that challenge is there. So you know, Dr. Spencer, who is, I don't know if you know him, he is a Columbia University physician who survived the Ebola infection. He was working in Africa and he got Ebola, and one of the few people who survived. And he is working in the emergency room in New York. And I heard him the other day, very eloquent gentleman. And his take was that, listen, this is not something that we were ever prepared for, we ever trained for. So for him to see physicians and healthcare workers and nurses and respiratory therapists who now have to work in a completely different environment. So you're wearing this highly cumbersome protective equipment, you're working long hours, seeing some terrible things happening in front of you, with some sense of helplessness and feeling that you know, the support in terms of at least the kind of equipment and the resources we need is not there. So the thing is that none of us was prepared for this, including, to be honest, to some degree, except our frontline physicians, maybe most other physicians. So getting through this period of time, I think you have to tap into a higher purpose. I think we all have to, and Dr. Hughes maybe alluded to it, but certainly part of resilience is having that higher moral compass, so to speak. Believing in altruism, believing in the fact that we can make difference for others, and feeling good about it, even though we are exposing ourselves to certain risks and dangers. I think the critical thing is for each of us to individually, I think the most important thing is that the community at large is very appreciative of what we are doing, even though we may have limited resources. So that's definitely a source of comfort. But I think each of us has to individually really tap into our inner reserves and try to be extremely proactive and innovative about how we deal with those at individual level, at community level, in terms of physician groups. You know, there are a lot of very supportive groups which are there on the social media where you can share what you're going through, learn from others' experiences. So I think we even have a bigger burden in some ways, because we have to present a certain strong facade, as Dr. Hughes mentioned, which is the same issue with business leaders, that you can't come across as vulnerable, you have to be the strong one. So to take care of yourself and people around you, you're going to really have to go out of your way to tap into whatever resourcefulness that we have within ourselves and whatever resources we can find on the outside. So Dr. Hughes, with that, would you like to add a few things to it?
Yeah, I mean, I think, one, thank you for all that you're doing. And I will also say that just really finding ways to regularly check in with yourself, whether that's using like an app or something. I think Dailyo is a good one that can just send you a push notification to check in on your mood and your stress once a day. It's very easy when you're working hard, long hours at the hospital or at your business, and then going straight home to family and meeting those needs, to really kind of never check in on your emotion and your distress. And there's so much data that just naming a feeling, like saying it out loud and acknowledging it, can really be helpful in coping. And so having some regular time scheduled to do that. I would also say knowing who your people are at work, that you can talk about these things you're experiencing. I know at UT Southwestern, for example, I'm helping put together some process grief groups for our medical folks that are on the front lines, because you are being exposed to different circumstances than normal. And again, a lot of folks who work in emergency medicine and the front line of ICUs are used to being around really difficult medical situations, and are used to the kind of loss and grief that can happen there. And at the same time, often in our medical model, you guys are trained to really sort of fight against that. You're fighting against death at all costs. And so it's really hard when that doesn't work and the result is death. And so trying to figure out how to talk to your colleagues about that and form some language. There's a lot of really great grief work out there, and the American Medical Association has some good resources up right now too about how physicians can kind of cope during this time of sort of high distress and high need that also feels so different from the typical working environment in some places potentially. So I think regular check-ins with yourself, making sure again as a leader or a healthcare worker that you're taking some time to yourself, even just a few minutes to take care of yourself. As you mentioned before, nutrition, eating, sleeping, figuring out times to move your body, that all remains important even when you're working so hard in this way. And then yes, returning to the meaning of your work and how important and valued it is. And, you know, kind of pulling into that higher purpose, as Dr. Raza called it. We know that that's going to be the thing that really pulls people through during this tough time.
I'd just like to add one thing to it, Dr. Hughes. There's recent data that actually came out of Wuhan regarding healthcare workers. So as one would expect, you know, the incidence of anxiety, depression, insomnia, there were variable numbers, but was anywhere from 35 to 70% of the people reported those symptoms. So this is going to be a very tough situation. I think the biggest concern is getting through this period is important, but previous pandemics have shown that healthcare workers, you know, people who are most vulnerable to long-term effects or even short-term effects are usually children, women, and people who are healthcare workers and those who have been quarantined. So these are the particularly high risk populations, and I think we have to be mindful how we deal with the current situation, but also keep an eye that this could linger on and affect us even in the long term.
Doctors, you all both mentioned the importance of exercise and nutrition relative to combating mental health challenges during this period. What do you recommend folks do who are under quarantine, who are really observing the shelter in place and not wanting to go outside and not wanting to expose themselves any further? What strategies do you recommend for getting fresh air and getting exercise for folks who may be under quarantine or in a challenging situation?
Dr. Hughes, you want to go first?
Yeah, I mean, I won't plug any one particular online program, but there are a lot of different workout opportunities online now. A lot of our local companies have created online content and ways to kind of jump on. And so it is a good time to kind of virtually visit a studio that's local and support a local business. A lot of them are taking by donation. There's also some free things through YouTube, et cetera. So there's ways to kind of try out different fitness classes and approaches. In particular, yoga might be helpful right now too. Some focus on breathing and stretching could be useful with layering exercise with a bit of mindfulness, which is that kind of non-judgmental attention to the present moment that's been shown to have a lot of good impact. So that might be a way to layer two healthy coping activities together. I would say if you have any tiny bit of outdoor space, even a patio or a yard, to spend a little bit of time outside if you're able to, and kind of move and stretch out there too, if you're not able to get out and are truly quarantined.
So I've not much more to add to it, except that the critical thing is to find a way to do it. And where there are outdoor opportunities, I think most people, you go to the park or a walking trail, you probably will be difficult to maintain social distance, particularly on a good day out. But I think even being able to walk in the neighborhood, just being able to sit in your backyard, I think it's very important to have some outdoor exposure during this time. But exercise it requires determination and an intention to engage in it. In all honesty, there are opportunities. You don't even require any special equipment if you really want to do it, as Dr. Hughes mentioned. There are very, very good apps that involve very, very brief exercises that can be done anywhere without any equipment. So I think the biggest thing is to really make up your mind that that needs to be done. And my hope is that, once we make those changes, the critical thing is the initial period. Once we get acclimatized to those and begin to see benefits of those changes, I think it becomes then a reinforcer or sort of an inspiration or sort of a facilitator to let you move forward and to continue to engage in it. So I think the key thing here is these are not ordinary times. These require extraordinary steps, and including, being proactive about these issues and finding innovative ways of doing it.
I think we have time for about one more question from the audience. Before we get to that, Phil Metters with LAN. Phil, you had a comment. Do you want to make that comment to the group?
Yes, Jeff. It was kind of interesting that there's mention of Dr. Kessler and his work at church about a week ago. One of our pastors mentioned an article in the Harvard Business Review. I put the link out there in the chat for our group chat for you to get. It's called, let me go back to it. It's called "The Discomfort You're Feeling is Grief." Is actually a pretty good reference, and thank you, Jenny, for mentioning that. So it's a helpful article.
I will add, if you like hearing a bit about Dr. Kessler's work, his new book just came out last year. And for those of you that are into podcasts, Dr. Brene Brown from University of Houston has a new podcast. And last week she interviewed David Kessler on her podcast about the book. And it builds nicely upon the article you're talking about. So if anybody's interested in kind of learning more about meaning making and how that might apply to this kind of sense of community loss and grief that we have right now, or collective loss, it's really a good 45 minutes of your time for now. So recommend Brene's podcast in that way.
Thank you, Dr. Hughes. And after this, we're going to circulate some materials that Jenny and the UT Southwestern team put together with some resources. But doctors, do either of you have a couple of things that you want to highlight that maybe the group should look at this afternoon or over the coming week?
I think my viewpoint is that one of the things we need to understand is that there's a lot of uncertainty ahead, and it is likely to stay that way. But there are also things we have learned from the past as to how these things evolve. So knowing for you folks, what are the different outcomes in terms of the business aspect? First of all, what are the potential outcomes for this? What will be the course of this pandemic? There are several theories. So McKinsey and company, I don't know if you've had an option to see, they put out a pretty good position paper highlighting how the three different scenarios where this thing may play out itself and how that could sort of economically and business model wise, supply chain wise, may have different impacts. So for you folks to really be, we don't know what scenario is going to play out, but for you to be at least aware what the three possibilities are. For instance, one is that, we get over this in the next 2 to 3 months and this thing goes away. The second is that we get some handle on this and it keeps recurring until we get a vaccine. Or the third thing is that this thing just doesn't go away and we have to just wait until we get the vaccine. So each of those scenarios are going to play out differently. The recovery from this is going to occur in different stages. Each stage is going to have its own challenges. And those are your very smart, successful, resilient, obviously your leaders in what you do. I think if you have a general concept of how things are going to work out, I think the specifics you can look up, specifics you can think through. So the key thing here is that despite all the gloom and doom, which, realistically, we have to go through for a period of time, that this thing could have a silver lining in the long run, that it could make us a better society, a more compassionate society, a more unified society, a society with a better sense of purpose, looking at things which are greater than ourselves. But the flip side is that it could also go the other way. So in times like this, societies can also move in a different direction. So you as leaders, leadership works at different levels. And during these difficult times, people are looking up to leaders to provide them with direction, to provide them with consistency. So despite all the challenges that you have a tremendous opportunity here to make a huge difference in people's lives while also trying to preserve and hopefully regrow your business in the future. So I wish you all the best. And if there are anything else that we can provide any advice on in the future, we'll be glad to do that.
I echo everything Dr. Raza said. One thing I didn't get to speak too much, but I have passion for, I just want to make sure I point you guys to the resource that you'll get. Supporting children and adolescents during this time, those of you that have kids, and then also I'm sure many of your employees that have children. And the National Child Traumatic Stress Network put out a really useful resource for parents about how to talk about COVID and how to help support kids, all different ages, from preschool up to adolescence. And some of the kind of developmental ways that youth will sort of show stress during this time, and some of the things that are important in your response to that stress. And so I just recommend you check out that resource and consider also sharing that resource with your employees who may have children, as that might help them as they balance work and life in a very direct way right now as they're home with their kids. Thank you guys for the chance to be with you today, and I'm also happy to help at any point in the future if another visit would be useful.
Thank you, Dr. Raza and Dr. Hughes. This has been a tremendous session. We are so appreciative of everything that you've offered, of the partnership with UT Southwestern, and this advice is stuff that we can put into use right away during this challenging time. So we thank you again for doing this. As a token of our appreciation, we'll be making a donation in each of your names to the North Texas Food Bank. And we really appreciate everything that you all have done. I want to briefly thank again our sponsors of this series, Capital One, Coles and Thompson, Dallas Business Journal, Higginbotham, and MarketWave. Thanks to the UT Southwestern team, Jenny King and Corey Tovian, for putting all this together. Without you guys, we could not have done such an awesome program. So thank you, Jenny and Corey, and I see Ruben as well. You guys are great. We just love working with the UT Southwestern team.